Do all children with autism need OT? And OT therapy for all kids, do they look the same? If you could address that, because what happens in many, I don't know if it happens in India, but in Bangladesh certainly, you see the whole classroom is receiving the same activity or same occupational therapy technique. Is that really something that should be really focusing on the child and should be individualized? Because I see that very often parents are like, oh, he's receiving OT with the class, and not really personalized enough.
Yeah, I mean that's a very good question. One of the things is children with autism very frequently, most of them, majority of them do need sensory interventions at least in their early ages, very early stage when they are diagnosed. A lot of them, most of them, you could say 90% of them. In fact, the research also has suggested that the sensory issues, the incidence of sensory issues among the population of autism itself is going as high as 90%. So if the sensory issues do exist in majority of them, you can assume that that OT would be required and recommended for majority of them. OT intervention is extremely individualized, very goal directed. It, it the OT might use the same uh, activities or same materials for sure, but the how the activity is being planned and implemented will really differ from child to child, and will also differ on what is his cognitive level to receive the sensory intervention, and what are his prioritized challenges which we are trying to take care or trying to overcome. If we say that children with autism are all different and they are very unique, then I assume that the OT intervention should also be very different and unique. What I do agree is the OT materials, right? A surgeon uses the same surgical tools for all the patients,
Mm-hmm.
but his technique, his procedure, his outcome, his goal will change from one individual to another individual depending on what he is bringing in as a problem. So my tools might still remain the same, but my activities, my procedures, my techniques, my strategies will differ from person to person. I think what is required is that the occupational therapist should discuss with the parent as to why he is doing what he is doing. If that is clear to the parent, I am sure the parents will not get confused about the materials that they see in the hand of the person or the therapist. They would rather focus on what is being done and why it is being done. So, children who receive occupational therapy also changes from age of the child. So, if I have a 13-year-old receiving OT versus a 2-year-old receiving OT, it is going to absolutely change because the materials being handled by a 13-year-old will be very different than a 2-year-old for sure. In otherwise natural course of differences also.
Sometimes the explanation we hear is like, oh, but cognitively he's at 2 years old. You have no idea how many times I've heard that cognitively he thinks like a 2 year old, but he is 13. So but like I feel like there is a lot of thing that parents often come and tell us that OT therapists, they do their one-on-one therapy, we don't really get to learn much from them. What do you have to say for that? Or do you really hear that in your clients as well, that there are therapy or therapy centers who don't really share what they're doing? And that brings to my next question: can parents really benefit if there are certain suggestions or activities that are guided through their OT therapist to try at home? Because I know for my child, I used to take my OT therapist to the shop, to the toy shop. So she would guide me to buy which toy are fun, at the same time will target some of his weaknesses. So what do you think this relationship should be, and can parents really at home use these techniques alongside with a therapist?
Absolutely. And And it is also important to note and learn that the work of the occupational therapist is also to make sure how his clinic based activities can be easily converted into a home based activity. There should not be a requirement to set up an occupational therapy department in your home. What is required is to make the parent understand the intention, the outcome that you are looking from the child. If you are looking at a goal like adaptive behavior and meaningful engagement from the child, then a parent might be more equipped in terms of material than a therapist, because he has a particular setup into which he has to accommodate various children, and their materials have been decided in terms of how many materials can be applied on a majority of people. However, a parent will have very unique set of things at home that may not be really be neither a good choice nor a feasibility for a therapist to have at the center. But
Mhm.
the essential thing required is that the parent sometimes may not see the connection between what is the intention that we are taking forward, what is the material that I already have at home and fits the need here, and how to implement. So the occupational therapist role actually does not end into the center or the clinical setting. He has a unique role of visualizing. If it is possible, he can visit, but in other ways, he has a unique role of visualizing what does the home setup look like, and what are the materials available, and how do you put a put a good fit between the materials available at home, the parents' feasibilities, which are different from parent to parent,
Mhm.
and the goal that I have in my mind as a clinician. These three things need to be put together, and the program varies. Every parent have also have their own strengths and challenges. There might be parents who may not have a lot of time. There might be parents who have a lot of responsibilities beyond the child, or the family related, or business related, or anything else. So there is a fit that you make between the needs of the child, the feasibilities, and the materials available. There might
Okay.
be certain material that the OT might recommend to buy and all. They are all part of that extended care that you have to provide to a child receiving occupational therapy. I believe that an online session has really broken those barriers to a huge extent, because now when I
Absolutely.
do an online session, I see the child's sofa in the background, and
We
I tell
can.
them what to do, what activity to do with it.
Right.
So